I want to bring in Dr. Tony Mok. He's the chair at the Department of Clinical Oncology at the Chinese University of Hong Kong. He's also chairman of the Li Shufan Medical Foundation. Dr. Mok, let me start with what we were just talking about in that report. Tobacco smoking linked to 1/4 of all cancer deaths in China. Why are smoking rates still so high?
Well, this has to do with both the economy and also the prevention. I mean, in terms of stopping people from smoking. China has not invested sufficient in tobacco control. Plus, there's a good part of China, actually, such like Yunnan province, depend on the tobacco industry for survival. So there will be a big barrier trying to stop the people from smoking and selling the cigarette as well.
Tony, as you look at the information, mortality rates falling in China, but the overall number of cancer deaths still increasing there. Why is that?
Now, for that, we have to distinguish between mortality and mortality rate. Now, mortality is total number of deaths. With the increasing population and also the aging population, we expect the total number of cancer deaths to increase. However, there is a good news that there's a slight decline in mortality rate with certain kind of cancer. Like, for example, prostate cancer and some early stage of the lung cancer, there's a slight decline of the mortality rate, partly due to the early prevention and partly due to the better treatment.
Now, some researchers think it's still a bit too early to talk about a link between air pollution and lung cancer, but you've studied this for years. What's your take on that?
Well, I think we have to look into the degree of the pollution. I mean, in the older study, we actually never had the type of pollution we have now in major cities in China, such as Beijing and Shanghai. So some of this effect of heavy pollution will eventually come out, and we can only study the impact of such by then. But then, knowing about the pollutant, potentially most of them are actually carcinogenic. So we expect the worst to come in the future.
Tony, what about prevention? What can people be doing right now as they watch this broadcast to try and avoid cancer?
Well, clearly, I mean, tobacco is a major cause. I mean, if you can avoid tobacco smoking, that takes a whole chunk of the risk away. Now, you cannot escape away from the pollution. So in a way of wearing the mask, whether it reduce or not is actually very difficult to say. But then on the early prevention, we're actually talking about early detection. Now, there had been a study that came out about 2 years ago from the New England Journal of Medicine that a routine CT scanning, a low-dose CT scanning can actually detect early-stage cancer. Now, but you can see in China, if we do a CT scan on an annual basis in all the smokers, the economic impact is huge. So we must actually invest in both the prevention and early detection in order to actually reduce the cancer-related death from lung cancer.
Dr. Tony Mok joining us from Hong Kong. Thanks so much.